Hi, my name is Philip Dockery, and you've probably seen me in a lot of videos on the Parker Cornea channel. And as some of you know, I'm finishing up my cornea fellowship here and starting on as a cornea specialist here at Parker Cornea after that. And so one of the things I want to do with this video is not only review the year that I've had as a fellow, but also explain why the Parker Cornea Fellowship Program is the best cornea fellowship in the entire country. And I think one of the things that makes us stand out the most for a fellowship program is our surgical volume and surgical variety. Where else in the country are you going to be able to do 200 DMECs as primary surgeon as a fellow, where you do that surgery from start to finish? In addition, I've done about 95 CARES or CTAC cases, 285 cataract cases, with about 200 of those being in the last 3 or 4 months. I've done about 30 pterygia, 20 to 25 PKs and K-pros, and a handful of DALCs. And additionally, I've done probably about a dozen glued IOLs, a couple of ICL surgeries, and a handful of trabeculectomies. But I think an equally surprising number to this, our surgical volume, is that I've done 0 DSECs. And a little bit of that is the mindset of this practice, that we can do DMEC in even some of the most complex eyes. So I've done DMEC in eyes that need a tube shunt revision, ones that need synechialysis and pupilloplasty, DMEC in eyes that have been vitrectomized and need a glued IOL. And so all of these eyes that often people see as ones that you need to do a DSEC in, we are learning to do a DMEC in here at Parker Cornea. And then so that leads me to the next reason why Parker Cornea is a great place to come work and train. Because we have this great surgical volume, but this great surgical volume and variety comes from our great clinic volume and variety. If you open a cornea textbook, the BCSC, or any of your standard textbooks in cornea, you are going to see a variety of pathology that is rare, complex, difficult to manage. We see all of that here at Parker Cornea. Any cornea problem you can imagine, we've seen here, or I've seen here personally in the last 12 months. And quite frankly, I've seen it multiple times on each thing in the last 12 months. Our referral network is multiple states. We frequently get patients from Alabama, Tennessee, Mississippi, Georgia, Florida, Louisiana, and sometimes even further away from that. We have satellite locations in 3 different states. 2 of those satellite locations are ones that I personally go to by myself as a fellow. I go to Tuscaloosa, which is my hometown, and Columbus, Mississippi. Both of those places are clinics that have kind of started within the last year. So they're ones that I've been kind of helped grow and develop as an ophthalmologist here. I've made connections with all of these patients. They feel like they're ones that I've begun to know personally at this point. I'm able to see them, evaluate them, decide which ones need to come for surgeries, which ones we can manage medically, and then which ones that we can have follow up locally with their eye doctors and co-manage with optometrists and ophthalmologists in the area. One thing that you don't learn very well in residency, or really most places of medical training, is how to build networks with your referring providers, like your referring ophthalmologist and your referring optometrists. This is something, when you're in a private practice, is critical, especially a referral practice is critical, because this is where your patients come from. And one of the things that I've learned the most over the last year, and the things that's been one of my favorite parts of the job, is learning how to build those connections and relationships with those referring providers. A lot of them have my cell phone number and I have theirs. We're able to text or talk about patients so that we're on the same page with them, and so that we can better co-manage patients, whether that be for medical reasons or post-operative reasons. And this is something that really sets you up for great success if you're wanting to expand your practice, and it being a different practice even so after fellowship. And so part of the networking is not only talking with them on the phone or talking with them via text, but it's also meeting them in person. And sometimes we do industry dinners where we meet local eye doctors, and sometimes we'll go to their annual conferences. This weekend, I'm actually traveling down to the beach to go to one of the optometry conferences, where I can meet and connect with more optometrists from Mississippi, so that we can help expand our network and reach more patients that need help in Mississippi, or at least need the services that we provide there. So this networking has led to the clinic being very large at this point. We're not just based in Liberty Park, but we have, as I mentioned earlier, multiple satellites in multiple states. Each provider goes to different satellites. As a fellow, you start by going to satellites with the providers, learning how that setup is, and then trying to see a lot of these very obscure pathology that gets referred from very far away at these satellite clinics. As you become more capable in your abilities, sometimes those satellite clinics are clinics you can go to alone and even establish your own clinics. The Columbus and Tuscaloosa clinics are like those for me. And the clinic volume, not only in our Liberty Park clinic, but in these satellite clinics is also very high. And it's something that is very different from, like, say, in residency, where you may see, at most 20, 25 patients a day. Here in fellowship, I've seen 80, 85 patients on some of my busiest days, especially at these satellite locations, which really just exposes you to so much more pathology and gets you so much more comfortable in seeing and managing and evaluating all of these patients, and really increases your clinical acumen for what to do on all of these complex situations. Another thing that's great about Parker Cornea and this fellowship program is that the practice's support for external training, or training people outside of this. We often have many visitors come in and learn from us here at the practice from all over the world. This year we've had people from Turkey and Poland and Brazil and many other places. But one of the very unique things is this practice being willing to send us out to train others. You've seen probably some of my other videos where I've talked about my experience going to Rwanda, and I was able to go there, not only perform a lot of the surgeries that we do in Rwanda, but also help teach some of the ophthalmologists there some of our surgeries, particularly CARES, so that they can then provide that for their patients moving forward. Something for me, global missions, is very important, so having a practice that supports that is extremely valuable for me. One of the other important things that I've learned here during fellowship is a lot of the business aspects of things, like running a practice, the billing and coding of things that you don't learn in an academic setting or in residency. And so learning those things helps you to become a more self-sustaining ophthalmologist, because when you're out in practice after fellowship, you'll need to know how to bill things and how to code for things so that you can get reimbursed for the work that you do. And so that's something that I've greatly learned this year, so that we can then, if we're getting paid for the work that we do, we can provide more care for patients. And really here at Parker Cornea, we not only try to provide care to as many patients as we can, but we also try to provide care at reduced prices for patients who can't afford it. And I think one of the final things that makes this fellowship program the best in the country is the culture of the location and the culture of the practice. When you're applying for residencies and when you're in academic settings and things like that, you always hear about the word family and how people are treated well. And in most academic settings, that's very much the case. But when you're at a smaller private practice, that treatment like family is exponentiated. The Parkers, both John Parker, Jack Parker, Bonnie Parker, who really runs the practice, have really treated me like one of their sons. And it's been something that's been extremely valuable. It's like we have our benefits that are in contracts, but if there's ever anything that I need, they're there for me. This past year, my wife gave birth to another child, and that whole process went so swimmingly because of the support here that I had at the practice. And so even though I had a satellite clinic that week that was one that I was supposed to go to alone, Dr. Jack Parker kind of took over my position that week so that he was at that satellite, the patients were still able to get care. And so we very easily can cover for one another when someone has to miss and be out without our patients having to have their appointments canceled. Often you hear with work environments that it matters so much about who you work with, more so than even what you're doing. And here at Parker Cornea, you have both. We're doing some complex care that you really don't see anywhere else in the country. And so the privilege of being able to provide that care is really special and unique. But we also have an incredible work environment where all of our employees are just such a pleasure to be around. And I'm not talking about just the providers like are my fellow ophthalmologists like John Parker and Jack Parker, and one of our PAs, Emma Scott. I'm also talking about all of our front desk staff and technicians and scribes. Every single one of them is just a pleasure to be around. And so having people that enjoy being at work makes you enjoy being at work, and it helps you just want to work all the more harder. You want to be doing a good job not only for yourself and for your patients, but also for your counterparts around. And so as a result, I've developed great friendships here, not only with the physicians, but also with the staff, because of how unique this place is, with how warm and welcoming everyone is, which has been really one of my favorite aspects of the entire job. As I move from this next phase, from being cornea fellow to cornea specialist at Parker Cornea, one of the things I'm most excited about is the training aspect of things, is helping train those that come after me. And so this coming year, we have an optometry resident who you'll see in some of our videos, Dr. Grace McCrite, and a cornea fellow, Dr. Carson Panovec, who I'm so eager to be training them in what I know about corneal disease and diagnosis and surgical planning and surgical techniques. So I'm just very excited about continuing in the tradition of training people here at Parker Cornea. And for those of you who are interested in applying for a cornea fellowship this year or next year or whenever, I highly encourage you to consider our fellowship program, because we want to train you to be one of the best cornea specialists in the country. So I realize this is a little different format from many of my other videos where explaining a surgery technique or talking about a diagnosis. This is probably more like a video blog. I'm not really that type of a person, but hopefully you enjoyed this and got some insight from how we are at Parker Cornea and how the fellowship program is here and how much I've loved it.